You okay in that position? Might be a bit better off there. Yeah?
Better.
Okay, so two flexion, outer flexion here. Inner flexion, that was flexion supination. Inner flexion is flexion pronation. Outer extension is extension supination. Inner extension there, and outer extension is extension pronation there. All right. These basically coincide with the full ranges of the different joints. So, ulnar-humeral joint, the PPM for that, the passive physiological movement, is basically supination and flexion. I'm doing the ulnar, so hold the ulnar, and there's my full range of ulnar-humeral flexion there, and extension pronation, holding the ulnar again for that. That should be a bony end feel. This should be a capsular end feel. For radiohumeral joint, the radius now, flexion is flexion pronation there, and flexion supination there. And for the radioulnar joints, both upper and lower, it's simply pronation and supination. And you just work the different variations to make a joint diagnosis. Okay, so the glides. Flexion, the ulnar-humeral joint, we're going to consider to have 2 degrees of freedom. It doesn't have that, but the second one, abduction, becomes an important pathological thing for biomechanics. So we're going to consider that as a one. So for the flexion extension, the olecranon is concave on the convex humerus, so the glide is in the same direction as the osteokinematic. So I've got my finger behind the olecranon, like a gun trigger, there, and I produce this movement. That my right hand holds the arm down, and all I'm going to do is lean my body over and pull up on the olecranon. So there is an anterior glide for flexion, and then for posterior glide for flexion, because he's big, I'm going to change my grip entirely, come onto the ulnar there, and rock it down into extension and glide it posteriorly. Okay. For abduction, the passive physiological movement is adduction and abduction. Not there's much of it, but you're looking for the end feel. And then the glides, because this is now a convex surface, the glides are in the opposite directions. So for adduction, it's going to be a lateral glide there, and a medial glide for abduction there. All right? So to manipulate abduction, an abducted ulnar when I'm taking an adduction, we do this. This comes around here. When I do this, when I thrust this way, which is what I'm going to do, thrust that way, it produces medial rotation. So then I've got to stop that. I don't have to laterally rotate it, but I've got to stop it from medial rotating there. So I've got my heel of the head on the medial epicondyle, and then down here I'm stabilizing the forearm. So what I'm going to do is I'm going to abduct the humerus on the ulnar, thereby adducting the ulnar on the humerus. So I'm going to basically stabilize the rotation, lean away and twist, and that will stabilize this lot. So I'm producing a valgus force there, and then thrust. So it's a short lever osteokinematic. I can try and do the same, although it's less easy to control, using the ulnar there, and then thrust the ulnar across laterally, and that becomes an arthrokinematic thrust. My personal preference is through the humerus. It's easy to control the arm for me. For an adducted ulnar, which doesn't happen very often that you have to worry about, we're going to come on the other side of the arm. Now I'm going to adduct the humerus to abduct the forearm. So this time now, this is going to produce lateral rotation, so I need to hold that in place there. Again, twist my body that way and thrust this way. There. All right? Radiohumeral joint, full range flexion, full range extension. All right, so it's extension supination, flexion pronation, and for the spin, the pronation supination of your radiohumeral joint, pronation supination, there and there. Checking the glides. If you're worried about the spin, it's a distraction technique. So I'm going to put my thumb between the radial head and the lateral epicondyle, hold the arm down, pull through the radius, and see if I can feel that little bit of movement. If not, the capsule's too tight. Doesn't happen very often. For the flexion extension after a kinematic, just leave it in its resting position. We can push the radius up, the capitulum for flexion, and pull it down for extension. So it's up and down movement this way. To manipulate this joint, we'll take it into flexion if that's what's needed. Come onto the back of the radial head there and push the shoulder up to stabilize the system. Come onto your thumb, which is on the radial head, with the heel of your hand. Lean on it, thrust up. To take it into extension, down. We'll come into it this way, get that out of the way there, and hold the, when I push down there, it's going to laterally rotate the arm, so I'm going to hold the arm into that medial position there, medial rotation position there. Come onto the radial head anteriorly with the pisiform area, lean on it and thrust. Okay.
Do you want to show that last one more time?
This one?
Yeah, maybe just from the top here.
Okay, so we're going to thrust this into extension. Pisiform area over the anterior radius, the head of the radius. There, hold the arm so it doesn't laterally rotate. Lean on it, thrust. Okay. For the inferior joint, sorry, that's radiohumeral. Radial ulnar is pronation and supination. The radius offers a convex surface to the concavity of the ulna superiorly and a concave surface inferiorly. So this now is basically a dorsolateral glide for pronation, so I'm pulling it this way dorsally and laterally, and I'm stabilizing the ulna there, then pushing it ventromedially for supination there. So it's that movement. Then for the inferior one, it reverses. So for pronation now, this is a ventromedial glide of the radius on the stabilized ulna, and a dorsolateral glide for pronation. Okay, for pronation, supination rather. To manipulate this, just move over the bed for me. Put the electron on the bed so it's stabilizing the ulna. Come onto the anterior radius there. Take up the stress, thrust dorsolaterally. That way. Take it ventromedially for supination, just let it rest on him there. The electron goes on the bed to stabilize it there. We come onto the back of the radius there, and we're going to thrust it ventromedially like that. Or this one, you can clobber it. Okay. For lower down, we'll come stabilize the ulna, and I'm going to thrust the radius ventromedially for pronation there, and dorsolaterally for supination there. Okay. All right, good.